What happens when we invest in the health of our young people today? There are over 15 million people in Malawi today. 1 out of 3 is between the ages of 10 and 24. That's over 5 million young people. Meeting the needs of this large population may seem like a challenge, but if we provide our young women and men with the right resources and opportunities, their advanced skills, energy, and innovation will drive economic growth and social development for all of Malawi. One key investment is supporting young people's sexual and reproductive health and rights. Research shows that investments in sexual and reproductive health protects the health and happiness of young people, builds the potential of healthy and productive lives, and improves social and economic development. Investing in young people is investing in our country. And just as our country is going through a period of great change, our young people are experiencing a time of transition that is full of challenges and important choices. With the right investment, we can help them make the successful journey through their critical period. These investments will keep young people, especially our girls, in school, help young people begin productive working lives by providing them with the information and skills they need to get jobs, and prepare them for their responsibilities as citizens to build a more democratic societies. The right investments will increase the age of marriage and encourage healthy relationships. And by increasing young people's access to information and services for contraception, they can delay childbearing until they are ready to make decisions together about the timing and spacing of pregnancies and the number of children they have. With the right investments, including investments in sexual and reproductive health and rights, we can support our young people as they grow into adults. Supporting their safe transition to adulthood means ensuring that young people have access to relevant information, services, and support. For example, we know that comprehensive sexual and reproductive health education empowers young people to make healthier choices about their behavior. Evidence shows that these programs help young people abstain from and delay sex and reduce the frequency of unprotected sex and the number of sexual partners, which helps reduce the spread of HIV and other STIs. Comprehensive sex education increases the use of contraception to prevent unintended pregnancies. It helps delay that first birth to ensure a healthier mother and a safer pregnancy. In addition to education, access to youth-friendly health services that recognizes the rights of young people and are tailored for their specific needs are critical. Malawi's National Youth-Friendly Health Services Standard, introduced in 2007, states that all young people should be able to obtain health services appropriate to their needs. That all young people should be able to obtain health information, including information on sexual reproductive health and HIV. And that service provider in all delivery points must have the required knowledge, skills, and positive attitudes to provide youth-friendly health services. If we provide youth-friendly health services according to these standards, we can help our young people feel comfortable seeking sexual and reproductive health care without fear of stigma or discrimination. Youth-friendly health services are important for both young women and young men and can improve health across a broad range of outcomes like contraceptive use. This is important because although the rates of modern contraceptive use have increased in Malawi generally, they remain low among young people. Among sexually active 15 to 19-year-old boys, less than half use modern contraception. These numbers among young women are even lower. Less than 1/3 of unmarried sexually active 15 to 19-year-old girls and only 1/4 of married girls use modern contraception. Increasing contraceptive use among young people, unmarried as well as married, could help reduce Malawi's high number of unintended adolescent pregnancy and needless maternal death. Because although adolescent is considered the healthiest time in a person's life, adolescent pregnancy contributes to 20 to 30% of maternal death in Malawi. The risk of death and disability is aggravated by unsafe abortion. In Malawi, half of all women seeking post-abortion care are under the age of 25. Increasing youth access to full range of contraceptive methods is critical to reduce the number of abortions. Improving young people's access to sexual and reproductive health information and services can also help reduce the spread of HIV and other sexually transmitted infections. Although rates of HIV are decreasing in Malawi overall, rates have increased among young people aged 15 to 17 years old. Even with the progress we have made, young people remain vulnerable to HIV, and we must do more. We must reach young people early with information and services so they can make healthy decisions now and in the future. One healthy decision is condom use, a key strategy for preventing HIV. Encouraging condom use is one way to engage young men in sexual reproductive health, but there are more opportunities. Young men can also be supportive partners for contraceptive use, and when they become fathers, for maternal and child health. Engaging young men in sexual and reproductive health is one strategy for combating harmful gender norms and improving gender equality broadly, which benefits both boys and girls and supports the achievement of national development goals. Ensuring that both girls and boys are able to take advantage of opportunities throughout their lives means addressing the risk and protective factors that influence sexual and reproductive health behavior earlier in life. Risk factors include things like discrimination, a negative peer environment in which young people are pressured to accept risky sexual behavior, and harmful practices like early marriage. Even though some risk factors may always be present in a young person's life, adults, communities, and young people can work together to nurture protective factors. Protective factors include things like teaching life skills to young people, promoting youth participation and positive relationships with peers, and helping young people feel connected to their families and communities. Ultimately, we want the protective factors to outweigh the risk factors, so young people can stay healthy and take advantage of education and employment opportunities throughout their lives. Investing in sexual and reproductive health and rights is good for our young people and good for our nation. For example, a study from 2 districts in Malawi found that early marriage and childbearing were among the main reasons girls drop out of school. So in addition to protecting the human rights of young girls, preventing early marriage and childbearing also supports investment in schooling by increasing the likelihood that a girl will complete her education. This has a positive impact on the lifetime earning, since research shows that each year of secondary education can increase her future wages up to 25%. And the more educated a girl is, the more likely she is to use contraception and avoid unintended pregnancy. To realize these benefits, we must invest now. Even though it has decreased in recent years, Malawi has one of the highest adolescent fertility rates in the region, with over 106,000 adolescent pregnancies every year. This costs the economy an estimated $57 million. It also contributes to high fertility and rapid population growth, since women are more likely to have many children throughout their life when they start childbearing at an early age. Investing in adolescent sexual and reproductive health rights is an effective strategy for managing rapid population growth, which is a key step to achieving economic growth. Countries around the world have shown us that by managing population growth and investing in young people, it is possible to experience a rapid and transformative economic growth. Let's take a closer look at one country, Thailand. Experience the demographic dividend. We're looking at Thailand's population pyramid in 1960. This graph shows the age distribution of the population. Each layer of the diagram is an age group, and the width of each layer is the proportion of the population. It forms the shape of a triangle when the population is growing rapidly because more people in the younger age groups at the base of the pyramid than in the older groups at the top of the pyramid. Looking at Thailand's population pyramid from 1960, we see that the majority of the population is under the age of 25. During the 1960s and the decades that followed, mortality rates declined. Investments in family planning led to rapid declines in fertility, so the population growth slowed down. With fewer births, Thailand was able to invest more resources per child, leading to more secondary school completion, especially among girls, as well as delayed marriage and delayed childbearing. By 2010, we see Thailand's age structure has changed, with fewer children and a smaller population of young people. This pyramid is now dominated by adults who can be part of a productive labor force and contribute to economic development. And population growth has slowed to a more manageable pace for families, communities, and the nation. Malawi has a population structure similar to Thailand of 1960, with a majority of population under the age of 25. Investments in sexual reproductive health of young people will help to ensure a healthy transition to adulthood, lower birth rates, and create conditions necessary for demographic dividend. However, this kind of economic progress is not automatic. As we see from Thailand's experience, it requires a series of investments across sectors to ensure that young women and men are healthy, educated, and equipped with skills and opportunities to contribute to the country's economic growth. Malawi can expand on its previous successes by making investments in the sexual and reproductive health of its young people a priority of national development. Those efforts should start with implementing the National Youth Policy as a key strategy to increase funding and support across all sectors for young women and men in Malawi. Standardize and rigorously implement comprehensive sexuality education and expand youth-friendly health services for all young people. Leaders at all levels must actively involve young people at all stages of policy and program development and implementation, and empower youth to be advocates for their own rights. Our investments are most effective when young people are included as stakeholders and active citizens. If we recognize the rights of our young men and women, especially their right to sexual and reproductive health care, and support them as they transition to adulthood, they will carry our nation forward into a bright future.